Coming into the game gave us a huge advantage ahead of other D2C players because 95% of the D2C players treat this product as an OTC product, which cause a lot of complications without the medical professional prescribing this treatment. From the first day, our treatment goes through dentist and orthodontist before the patient could really purchase our clear aligners. We have a lot of customers, local interns that they're in Malaysia. Some of them, their work can based in Australia, UK, or even the States. But through our technology, we are able to monitor the progress of the treatment and deliver the perfect smile despite being so far from the first initial clinic that they went for the checkup or placing the attachment. Yeah. In the start, a lot of players in this industry like dentists or even the suppliers, they don't even trust us because we are not in the industry. And then through the years, 2 years later, so we were invited to being part of the association and more dentists came to really want to join us, orthodontists.
Hi folks, welcome back to On Call with Insignia, where we go on call with leaders innovating the future of Southeast Asia's and other emerging markets, internet and digital technologies. I'm your host, Paolo Quino, and we're back with another Insignia Ventures Partners portfolio company, a recent investment that the firm made, and a quite interesting one, given the space that they're in, not, I guess, the typical suspects of industries that venture investing would go into, but all the same, quite impressive how much the company has scaled up even prior to Insignia Ventures' initial investment. And they're very much scaled across several markets in Asia, delivering dental care products, primarily clear aligners, across all these markets. So I'm talking about none other than Dr. Clear Aligners, and I'm really happy to have on call with us their CEO and co-founder, Ryan Teo, with us. So maybe we can start off with maybe for you to share how exactly you decided to start Dr. Clear Aligners.
It was during the pandemic, 2020. I was doing a marketing company at the point of time. At the same time, I also want to provide a healthcare plus aesthetic service product that is easily accessible to everyone. Hence, I chanced upon this product, Clear Aligners. I approached people I knew in the industry, in the manufacturing industry, in the plastic, and also like dental industry to get more knowledge. Then after we chanced upon to Clear Aligners, and we launched the product just later in 1 month time.
Wow, that's pretty fast.
I could say it's pretty fast as compared to the speed right now because previously the skill was like just me, Kevin, Jaden. But right now we have a huge team, so we need to have a lot of meeting planning before we go into execution.
But would you say you were a complete outsider to the industry prior to really building this out?
Yes, I'm like a complete outsider except for the marketing part.
Except for the marketing. Okay, so you did have experience marketing like related products in that industry. So I think what's been really interesting about Dr. Clear Aligner's journey, so started in the pandemic 2020, 4 years on. But by the time that you introduced this into the market, there were already existing like tech-enabled clear aligner platforms that I'm sure some of our listeners may know themselves. So for you and for Dr. Clear, how did you think about differentiation, especially in that 1 month sprint to launch? Was that something that you were thinking about, or did you develop that over time? And yeah, was there an advantage to actually coming quote unquote late into the game?
Before we developed the tech, we were like monitoring the photos as well. But then we collected all the patient data. But then all this was done without tech. So that's why we were able to build this tech as we collected the patient data through 6 to 8 months. Then we started thinking that we should really build some tech to really automate this. We were one of the first enabled clear aligners in the world. But of course, there were other brands offering similar tech, but they are leveraging on other tech companies instead of everything developed by themselves.
And then, to my other question about coming late into the game, we always talk about the advantages of being an early mover, first mover, but not necessarily being that. Were there any advantages to that positioning for you guys?
Coming late into the game gave us a huge advantage ahead of other D2C players because 95% of the D2C players treat this product as an OTC product, which cause a lot of complications without the medical professional prescribing this treatment. But you only see this effect after 2 to 3 years because this treatment is not a treatment that you could take it and get it done like the next week.
Right.
Yeah. So from there, from the first day, our treatment goes through dentist and orthodontist before the patient could really purchase our clear aligners. For the start, we only do like simple cases instead of going to class 2 and 3 and the most complex cases. But right now, we could offer to all kind of cases.
Oh wait, that's an interesting point actually, that you didn't really try to solve for all the different types of use cases for clear aligners, but really focused on the basic ones. I didn't know there was that kind of segmentation when it comes to those use cases.
For the start, we couldn't really do all cases. We were working through like partner clinics or this, then the dentist doesn't have full trust in us. So we could only do simple cases. We also don't have the full team of like orthodontist support. So we try to really minimize the risk and also do what we can, and instead of doing all kind of cases.
So that there's a clear intention to actually include that in the journey and automate that part of the process, as you mentioned, like initially before it used to be manual. I think another notable aspect of Dr. Clear Liner's journey is the global expansion, 7 markets in 4 years, which is no small feat, and without any kind of like outside capital. Yeah, I'm very curious, and I'm sure our audience is as well, who's more used to venture-backed multi-market scale, like how you guys approach market expansion in terms of timing and really building inroads into the dental care ecosystem. Yeah, maybe you can start with what was the first market outside of Singapore, right? Like, what is the second market essentially?
The second market outside of Singapore is Malaysia. It's one of the best move for us because right now most of our team is based in Malaysia, and Malaysians are fluent in like English, Chinese, Cantonese, which make the market expansion overhead less stretched as compared to having more headcount in Singapore, Hong Kong, or Australia. That's why we at the same time rapidly expanded to UK, Australia, and Hong Kong, but also using the infrastructure and back team of Malaysia.
So actually, like expanding into Malaysia actually laid the groundwork for you to be able to expand into markets like Hong Kong and Australia. And yeah, and I think even today, like Malaysia is one of your key markets as well, right?
Yep, Malaysia is our key market, and followed by Thailand. And we also have our own manufacturing grounds in Malaysia and Thailand.
Yeah, you've like segmented kind of the different markets you're in. Like Malaysia and Thailand have like manufacturing in them. How else do you like segment the different markets that you guys expand to? Or you only like partner, and then certain markets where you would want to set up like your own flagship clinics, right?
Most of our market, we want our flagship clinics to be there to really be in charge of the end-to-end process. But like for Singapore, Australia, or even like New Zealand, we don't really want to set up production there because I can say the overhead there is too high, so it doesn't really make financial sense for us to really set up too much manufacturing ground.
And at this point, you're mostly like East Asia, ANZ as well, as you mentioned. What's next in terms of your expansion plan?
So South Asia and the Middle East is definitely our expansion plan. The Middle East doesn't have a direct-to-consumer aligner brand, but we can see the market is growing tremendously over there for some other aligners players. We are still exploring the various options to really go into market penetration instead of opening our own flagship there, but the chain of clinic there, the top chain over in Middle East, instead of just having our own clinics there. So we are still finding our way out, but Middle East is definitely in our plan. We did make some connection with Middle East government through Insignia as well.
We've definitely seen interest in Insignia's portfolio for Middle East expansion for some of our portfolio companies. Definitely trying to set up those bridges for them, Dr. Clear included. And then, yeah, we mentioned earlier that key differentiation for Dr. Clear is the focus on post-treatment monitoring. Yeah, how does this, maybe you can dive a little bit deeper into that, and how does this strengthen like Dr. Clear's positioning towards not just the customers, but as well as the clinics that you partner with to distribute these clear aligners?
The most important is that we don't need an additional device from the doctor or patient for the monitoring, which is a very important aspect of the system, which makes the provider and customer very convenient. There are other systems that that does this, but they require like additional device to be tagged to your phone, which makes this a bit complicated, and the doctor has to like sell another thing, which is a device that still might be dropout rate through this process. But for us, it's very convenient. You just download an app and you can immediately use.
This also sets up a unique kind of like scenario where I guess like the monitoring could potentially even happen cross border. Is that right?
We have a lot of customers, local interns that they're in Malaysia. Some of them they are working based in Australia, UK, or even the States. But through our technology, we are able to monitor the progress of the treatment and deliver the perfect smile despite being so far from the first initial clinic that they went for the checkup or placing the attachment. Yeah.
So it's a form of kind of like healthcare tourism that you guys are supporting and enabling. So that's quite interesting. Another aspect of what makes Dr. Clear aligners quite interesting is also the development of their own flagship clinics, which I think not a lot of like tech-enabled players venture into, but Dr. Clear has already. So what was behind this decision in particular? Is it purely just to own the whole kind of like process and have more control over it? Or yeah, what are the other factors that drove you to expand into your own clinics as well?
First of all, we want to own the whole ecosystem from manufacturing to distribution to fitting on the aligners, everything in aligners. We want to be in charge of the entire customer experience flow from the time they make inquiry for the aligners till they complete the treatment and bring down the CAC at the same time. Because customer experience is very important nowadays, even in every kind of business.
How do you balance this kind of the setup of these clinics with the ecosystem of partners that you have?
So we launched a DCA Pro, B2B aligner system for the partnership clinic to differentiate our direct-to-consumer aligners so that both B2C and B2B revenue segment could grow at the same time. DCA Pro is a system that requires the doctor to supervise the treatment in person monthly. That means in a way that most of them, they don't use DCA treatment monitoring. The dentist still wants to take charge of the entire treatment sometimes. It's still bear a DCA name, but it's more like the patient having more trust in the dentist, or even the dentist sometimes doesn't trust the technology. So the easiest way to really penetrate into the B2B segment and B2C segment is launching another system that doesn't require tech at the same time.
Apart from setting up your own flagship clinics and this whole kind of B2B arm that you have, you also have another way to roll out adoption of your clear aligners.
So recently we acquired the most luxury dental chain in Malaysia with a total of 30 super general practitioners and specialists. So with this support and our strength of marketing and acquiring patients, we are launching out our franchise in Q1 next year.
That should be something our listeners can look forward to. And yeah, if you guys are listening to this podcast, and I don't know if you know anybody who's interested in this program, yeah, maybe you can reach out to Ryan and talk to him. Yeah, so we've covered pretty much a lot of the different aspects, which I think really make Dr. Clear Aligners quite an interesting company, especially as a venture-backed company. But I also wanted to focus on the overall kind of like global dental care opportunity or clear aligner opportunity, since Dr. Clear is pretty much a global company. And so what role does Dr. Clear play in this global opportunity?
We always position ourselves like just not like a Southeast Asia player. We always want to be expanding our services across Asia and Middle East. But we chose Southeast Asia as a stepping stone because we are quite familiar with how Southeast Asia does business or this. Yeah. So we like a stepping stone before we launch our proprietary system around the world, especially in Middle East, South Asia.
Could you share a little bit more about your views on, because I'm interested to know what your views are in terms of the competitive landscape, especially with the emergence of this category of clear aligner, tech-enabled clear aligners, or clear aligner quote-unquote disruptors, right?
The global market for dentistry is changing really very fast. You can see like large corporate like acquiring aligners players, but also at the same time closing down their aligners brand in some of the market, which really makes sense for us is that in a way that we do really have a space to grow, so that the large corporate dental corporates is still afraid that new players are still coming in terms of future, more dental companies will be speaking to us in terms of funding or even buyout.
That should be quite interesting. So I guess greater consolidation as you have more of these like smaller emerging players coming in, which could be an opportunity for Dr. Clear in either direction. So that should be quite interesting to look out for in the next few years. I also wanted to know more about yourself as a leader, right? Like having led and grown Dr. Clear Aligners, and you mentioned earlier, obviously it's a lot more complex, the organization that you're working with now. Before it used to just be the three of you co-founders, but now there's like a whole organization that you are managing. Yeah, any like challenge in the past 3-4 years that you overcame growing Dr. Clear?
In the start, a lot of players in this industry, like dentists or even the suppliers, they don't even trust us because we are not in the industry. Through the years, like 2-3 years later, so we were invited to being part of the association, and more dentists came to really want to join us, orthodontists. They used to like really call us a DIY aligners, but right now most of the dentists or most of the industry players know our brand out there, and then a lot of dentists would love to join us.
Yeah, so it's always quite interesting when the industry you manage to change the minds of an entire industry, and really the proof is in the pudding, so to speak. Maybe you can also speak to, and that, obviously that is no small feat, as I mentioned earlier, changing the way an industry perceives your company. And obviously you had help, right? You had your founding team and your growing organization as well. What are some of the, speaking to your co-founders, what are some of the strengths that you guys, how are you able to really complement each other and really growing the career?
I'm more on the BD side and also the marketing. Jaden is more on the operation side, and Kevin is more on the compliance. Everyone has different aspects. Even though we have different thinking, but we always have a common ground to really execute the plan.
And I'm curious to know, like, how do you know your co-founders? Did you were you friends with them already and then invited them to build this together with you?
Me and Jaden, we have been friends for 15 years.
Wow. Okay.
Kevin is my business partner I knew him like 7 years ago, 7 to 8 years ago. Yeah.
So there's already that kind of like trust as a founding team, and obviously that's very important. And finally, I think we've always been emphasizing throughout this conversation how Dr. Clear has achieved a lot of this, what we talked about, without raising funding. But ultimately, you guys decided to fundraise 4 years on. What made you decide to get into the fundraising market? And yeah, how has becoming a venture-backed company shaped yourself as a leader, right? Do you feel like, yeah, how has it like influenced your mindset when it comes to growing Dr. Clear?
The main reason for fundraising is that I want the team to have more stakes in the company, like ESOP, so that everyone could stay motivated and work towards the same goal. Another thing is that even though before the fundraising, I could say that my company was like 200 mil, 300 mil, but then there's no really some value pegged to it until there's a venture back or the value back to it. Then we can really convince the team that right now we are going to somewhere. A lot of people think that we are just like building it for profit out of ourselves. Yeah, that's like a brick and mortar business. Every year it's like how much we earn, then the founder stake, then.
And how was your experience meeting Insignia and working with the team?
Before meeting Insignia, I've met a couple of VCs and PE. Inlan and especially Inlan, gave me a strong connection that really convinced me to have him to be part of a DCA instead of choosing other VCs and PE at the point of time. At the point of time, I do have 2 other term sheets on the table, but we decided to go with Insignia. Yeah, we made the right choice because they have Insignia have been like super supportive of what we are doing, and they have been making a lot of introductions to government agencies or other funds, or even some of your portfolios. Like right now, we are working with your other portfolios in Thailand to grow the market as well.
That's super interesting. I think it would be even greater to have a podcast and conversation with you and our and the other founders that you are working with, talk about some collaboration that you guys eventually do, but maybe that's for another episode. But in the meantime, I think this was a great opportunity for us, especially those in the startup ecosystem, to get to know Dr. Clear, those who are listening on the podcast. But yeah, thanks so much again for coming on call with us, Ryan. If anyone wants to reach out to you, I'll leave your LinkedIn in the podcast description, and anybody can reach out, and if they want to take this conversation further, or if there are opportunities there in terms of partnerships, especially down the line, say even like the Middle East or South Asia, where you guys are looking at in the future. But yeah, thanks again for coming on call with us, Ryan.
Okay, thank you so much. Thank you so much, Ralo.
Okay.